Much for staying with us here on Morning Live. Now, the feared Zika virus in major parts of South America as well as in Africa have been concluded by the World Health Organization as being responsible for the exponential birth of babies born with severe neurological defects. The Zika virus was, however, left mothers with an ethical and moral dilemma of late abortion. Professor Sylvester Chima from Medical Ethics at the University of KwaZulu-Natal joins us this morning to talk about technology that can be used for early diagnosis of abnormalities. Prof, good morning to you and thank you very much for your time.
Good morning.
Now, Prof, you used the Zika virus as an example that women in South America have an option to abort late pregnancies, and that leaves a moral and ethical dilemma. How does that affect South African women in general?
Well, in terms of the law, South Africa has the Choice on Termination of Pregnancy Act, which allows any woman of any age to actually terminate a pregnancy for various reasons. In the first 12 weeks of pregnancy, a woman can, ask for termination of pregnancy for any reason. In the second trimester, from about 12 weeks to about 20 weeks, you can have, termination for things like assault. If you have severely malformed, pregnant with a severely malformed baby, or if there's a danger, the baby causes a danger, poses a danger to the life of the woman. And also up to the 40th week of pregnancy, a woman in South Africa has the option of having the pregnancy terminated due to severe congenital anomaly. An example of that will be, of course, what we're talking about, which is microcephaly due to Zika-virus. So in South Africa, women do have that option of having the pregnancy terminated. Now, the problem with South Africa is actually for people to know that they have these rights and also that they can actually access these rights. Now, it's incumbent on most healthcare professionals, especially doctors, to be able to accurately diagnose a woman who has a severe congenital anomaly or who has a baby with a severe congenital anomaly, so that they can be able to have that and explain to them that they do have that option to actually have the pregnancy terminated. And this comes to the issue of consent, in the sense that even though the law is there, the majority of healthcare workers that were, that we interviewed in a survey that we did in Durban, actually did not know the clear essence, in terms of when can a woman get a pregnancy terminated, under what conditions can they get a pregnancy terminated, and what kind of consent do they need. So the problem with here is that doctors have to make the patient aware, even though we do not have a problem with Zika virus in South Africa. However, because of the issue of globalization, where we have a situation where people travel all over the world, and because of the ease of travel, it's quite easy for somebody who, a woman from South Africa, for example, to travel to, South America, where this disease is prevalent, and then come back pregnant, and then there's a possibility that they could have a child with a microcephaly. So the doctors have to be able to explain to them that they do have this option, and this is actually what we are emphasizing in this particular situation.
If women have so many rights, especially in South Africa, to terminate their pregnancies, why do you think many resort to illegal abortions?
Well, the problem with illegal abortion, again, it comes down to knowledge, okay? Knowledge of the fact that you actually have these rights under the law. That's one. The second aspect of it is the fact that when they go to doctors, because of also cultural, religious reasons. This is one of the problems that where the Zika virus is causing a problem in South America. Because of the religious views of the people there, they do not allow termination of pregnancy for any reason in many of the countries that are affected. So women are being forced. It's a moral dilemma. They are being forced in a situation where they don't even have a choice, to be able to terminate the pregnancy. However, in South Africa, we do have that option, but then it comes down to issue of knowledge. The people are not knowledgeable about their rights. Also, when we did this survey, this study that we did in Durban, we found out that only about 5% of our patients in KZN, for example, actually aware of their right to informed consent, or the age of consent to treatment. That's the specific question that we asked of them. When we posed the question about, at what age can a woman, actually terminate pregnancy in South Africa to healthcare workers, only about 30% of doctors were able to correctly identify that any woman of any age And in the case of professional nurses, only about 5% of professional nurses actually knew about this information. So the implications of that is that doctors, even the healthcare workers who are supposed to train the patients, are not able to educate the patients because they themselves are not educated. And this is why we need continuous professional development courses, for example, that what we're going to be doing in Africa Health, which is basically to help educate doctors about the ethical and legal implications of, of medical care, including in this case, we are using the Zika virus and reproductive health as just as a case study to show, to kind of illuminate the need and the importance of doctors being aware of these things and then the implications under the law.
Yeah, so it looks like there's still a long way to go in terms of education of termination of pregnancy. But just in conclusion, Prof, how lenient are South African laws in terms of termination of pregnancy as compared to other countries?
Actually, that is one of the most important things that comes out of here. It highlights the importance. South African laws are very liberal. They are consistent with what the United Nations wants in terms of actually allowing women the choice. Again, remember, this is not about force, it's about choice. Now, in South African law, we have this 1996 law that is called Choice on Termination of Pregnancy Act, which actually gives any woman of any age, in the first 12 weeks, for any reason, you can get a pregnancy terminated. After 12 weeks, then you have to go to reasons like incest, rape, in which case they can get it terminated, or if the baby is severely malformed, or if the baby poses a danger to the life of the mother, then you can get it terminated. Now, up to 40 weeks, where you have severe congenital anomaly, which is identified by two professional healthcare workers, as two doctors who are qualified, with a certain, for example, in case of microcephaly, say, oh, this person has possibility, has a diagnosed microcephaly, and there's a possibility they could have a severely malformed baby, they could have that pregnancy terminated. Now, the other part of it that we need to talk about is the issue implications for doctors. Because the law is so liberal in South Africa, any doctor who does not properly advise the patient that there's a chance that they are carrying a severely malformed baby stands the risk of being legally challenged for negligence, in the sense that they can be accused of negligent practice, and then they can get sued for what we call wrongful birth or wrongful life. Okay. Now, in the case of wrongful birth, is that a doctor did not properly diagnose a baby, for example, with severe congenital anomaly, and then gave the mother the chance to be able to terminate the pregnancy if they wanted. So if they don't do that, they could go to court. And actually, there have been cases in South Africa where people who have, where the doctors have failed to properly diagnose this, have actually been sued to court, and the case, charges, damages have been awarded against them. Okay. On the other hand, if a baby is born with a severe, yes.
Okay, Prof, I'm afraid that's where we're going to have to leave it. I do know that you do have more information for us, but we'll make a day for it again. Thank you very much for your time.
Okay, thank you.
Thank you very much indeed. Well, that's Professor Sylvester Chima from the Medical Ethics at the University of KwaZulu-Natal talking about the Zika virus. Leanne, what do you have for